more folks to join today's webinar on New York State Behavioral Health Value-Based Payment Readiness Program, Workplan, and Budget Templates. My name is Boris Vilgorin. I'm with MCTEC, McSilver Institute at NYU. Just a couple of logistics and housekeeping before we get started. This presentation, the slides will be posted on the MCTEC website. We also encourage folks to chat in your questions. Most of you are probably familiar with this option, but if you're not, it's on the upper right-hand side. There's a chat indication, so please click on it and you'll be able to chat in questions to us. We will be collecting all the questions and sharing them with the state, and hopefully later providing a Q&A with the answers to those questions. Again, as I mentioned, the presentation will be posted the slide deck on the MCTEC website. And with that, I'll be turning this over to our state partners, both OMH and OASIS, who will be leading us through this presentation. So thank you, everybody, again. Lynn, Ileana.
Great. Hi, good morning, everyone. Thank you, Boris. This is Ileana Meltzer from OASIS, together with the combined OMH and OASIS BHCC team. We'd like to welcome everybody. Today we're going to do an overview of the work plan and budget templates. And just to emphasize, as Boris has already indicated, we'll be handling questions off the presentation through a produced FAQ document. So as we're talking, if you have questions, please submit them either to the chat box or to the related VBP mailbox, and we'll be responding to questions that way. So thanks. So first and foremost, congratulations to everybody for becoming awardees within the BHCC program. We are very excited to be working with both the provider and plan partners as the field in general progresses towards value-based payments. The webinar today is intended to provide an overview of the two documents that were previously shared with the BHCCs, the BHCC work plan and the BHCC budget template. As a reminder, those documents were previously transmitted to everyone on January 18, and to date we've already received questions from a variety of BHCCs, so we've been able to incorporate responses to those questions throughout the body of the presentation. Again, any questions, either submit them to the chat feature or to the VBP Readiness mailbox. And we will be sharing the PowerPoint with the BHCCs after today's webinar. And we would encourage the BHCC leads to disseminate the PowerPoint to your networks and affiliates upon conclusion of today's presentation. Next slide, please. Thanks. So just a quick overview of what we're doing today, talk a little bit about the purpose, remind BHCCs of upcoming due dates. We'll overview the preliminary work plan and its intent, including the pieces of that work plan, which are the organizational structure, data analytics, quality oversight, clinical integration. We'll also talk a little bit about the budget template, and then finally we'll send people to some resources should you have additional questions. Great, thanks. So hopefully this next slide is very well known to everybody. We signaled throughout both the original start of the BHCC discussion, within the overview documents, within the templates, basically what the overall purpose of this particular project is. And its primary focus is to help behavioral health providers prepare for value-based arrangements. As stated in both the document that folks use to submit their applications, the final deliverable is to contract in a level 2 or higher arrangement as either a level 1 provider or as a contracted entity in a level 2 arrangement. And again, the status of those VBP arrangements will be signaled to us throughout the progression of the BHCC project. Main goal always, and this is not only part of this project, but you hear this theme consistently as you're speaking with state representatives about transition to VBP, is the concept of integration and close care and coordination and collaboration between both physical health and behavioral health providers. This specific set of funding is intended to use to enhance quality of care through financial and clinical integration and to facilitate behavioral health providers' transition towards VBP. We also would anticipate that BHCCs will use the funds to collect, analyze, and respond to service data as they look to improve behavioral health and physical health outcomes. So a couple key pieces of work that at this stage in the game should be well known by the BHCCs is the initial contract. Upon the initial funding will be released upon signature between the contract between the BHCCs and the plan partner. Preliminary work plans are due to the state on March 22nd and to your BHCC plan partners. So 2 places to submit those. We'll talk about that in a little bit. And then that second payment will come after that preliminary work plan has been reviewed and approved. So just a few pause points regarding the contract in response to some questions we got from BHCCs. Is the BHCC program contract is between the BHCC lead agency or the other legal entity that was awarded the BHCC funds, for example, an IPA. The state is not a party to the contract. I think at this stage in the game people knew that, but a few weeks ago there were still some questions about that. And so while we did work with the plan partners to develop a suggested template for the contract, the specifics of the contract and final terms and negotiations are between the BHCC and the plan partner. And then finally, a couple folks were asking about at the conclusion of the 3-year period, any contracts post that date are between the contracting parties. Just a reminder, people had asked about that work plan. Does it get submitted to the state or to the plan partners? Answer is it gets submitted to both, and when you're submitting it to the state, you can submit it to the VBP mailbox, and when you're submitting it to your plan partners, they'll let you know where it should be submitted to. All right, so next slide, please. So that preliminary work plan and the ongoing work plans, the work is focused on 4 BHCC readiness areas. And the 4 BHCC readiness areas should be very familiar to the awardees, as those were also the areas where you spoke to us in the actual application. So the work plan areas are organizational structure, data analytics, quality oversight, and clinical integration. We received some inquiries from the BHCCs about how they should think about the work plan, the preliminary work plan, and the ongoing. And we're advising entities to think about both the preliminary and the ongoing work plan as the elaboration of material and planning objectives that were already discussed in the submitted application. As discussed during the pre-application briefings, the expectation is the BHCCs will do work within all 4 of the readiness areas, but that work will vary by BHCC based on that individual BHCC's intended objectives and focus. There will be variability among the work done by the BHCCs that's expected and is encouraged. So it is not expected that all BHCCs will have the same work across all 4 readiness areas. Finally, to support that flexibility, both the work plan template and the associated budget template, while they do emphasize key areas of each BHCC work plan, they're not intended to be overly prescriptive. We wanted to preserve the BHCC's ability to be flexible on the work that they were focusing on as it was specific to their own network and affiliation group. The overall intent of the work plan template and the associated review of that template is to allow the BHCC plan partners, in consultation with the state, to have an understanding of the BHCC work in the 4 readiness areas and understand and see evidence of that BHCC's progress towards both completion of the work and the deliverables that the BHCC itself signaled to us that it would be doing in the 4 readiness areas. Next slide, please. So regarding the preliminary work plan is the release of the BHCC Year 1 second payment and any subsequent funding in the out program years is contingent upon submission and approval of the preliminary work plan. And what that preliminary work plan does is it includes your timeline for each of the work plan areas, and that'll tie back to the proposed budget. So again, the preliminary work plan is a required element of the BHCC project. I'm emphasizing that because we did get a question, is it required? The answer is yes. The second program year, second year 1 program payment is contingent upon submission and approval of that preliminary work plan, by the March 22nd due date. We would anticipate that BHCCs are already working on that work plan because, again, it's an elaboration of the conversations that the BHCCs already had when they submitted that initial application. As you review the work plan template, there are a few things to really note. Is the BHCCs must utilize both the template format and the ordering for a work plan submission. That's important because what that will allow us to do is just a couple things. It assists the BHCCs as they organize their vision around BHCC activities. And also importantly, using and sticking to the template allows the BHCC plan partner to facilitate review of the work plan. There's a total of 28 required elements that must be addressed in the submitted work plan. All elements must be addressed. Please don't leave blanks. The submitted work plan and budget information is intended to provide us with sufficient detail to allow the reviewers to understand the work of the BHCC and what the BHCC funds are being used for. Excuse me. And then what that preliminary work plan will do is it will provide a current assessment of anticipated activities in the 4 readiness areas, and the subsequent work plan updates will allow both the plan and the state to see progress. So with that, I will transition to Lynn.
Thanks, Ileana. So good morning, everyone. Again, congratulations. We are really looking forward to working with you on this project. It's been exciting to have these conversations beginning and learning more about what you're planning to do. I have the joy of going through the organizational structure with you guys. There's been several questions about this, which I hope we'll be able to address during this webinar. And any future questions, again, please do submit them to the chat and or the VBP Readiness mailbox, and we will get answers out to you. So in the preliminary work plan, the first section, the first readiness area is organizational structure. We're asking that you describe what kind of organization you envision for the BHCC. Some BHCCs are already IPAs. Some are planning on going in that direction, and some are planning something different. What we're looking for here is either what you already are and or where you're planning to go and how you're planning to get there. We understand that several BHCCs, these networks just came together for this project. You may not have a firm answer yet. You may be in development of figuring out what that is. That's fine. Tell us about that too. What we want to know is how you're planning to get to the decision or what the decision is and how you're planning to implement it. So the next thing would be the communication plan. This is at least twofold. There's a communication plan between the BHCC members, between the lead and the network partners, between the lead, the network partners, and the affiliate partners, and even the BHCC and the community. You probably know that you're already starting to communicate with PPSs, with primary care practices, with large hospital systems. What is the plan for those communications? How are you going to communicate those communications to your plan partner as part of the work plan? And also, the second piece of that is what is the communication plan with the plan partner? The contract will have some of that lined out in terms of quarterly phone calls or submissions. Well, what else? How else are you planning to talk to your plan partners? We want to know if there are issues that are beginning to arise. Don't wait until the quarterly submission of the work plan or of your phone call to tell folks about that. You can reach out to the state, you can reach out to your plan partner if there are issues that you need help resolving. And so the work plan should say how you're going to do that. Okay, the Excel member submission template. This is going to be a required element in every work plan update, including the preliminary work plan. The link, you already have it, you used it for the application, and it will be in the same place, and it's here on this slide. It needs to be updated with every submission. If there's no changes, you can let us know that, but if there are, they should be highlighted. The state is considering, I think you know that we sent out the list of the BHCC leads and network partners and several requests for folks who want to begin networking and communicating with you all, and that's posted on our website. There has also been a request for the affiliate partners to be posted in order to facilitate the most accurate posting of that information and updating of it. We would like to post the submission templates right to the website by BHCC, both the network and lead tabs. We want to check with you first to see if there's any concerns about that. Go take a look at the tab, see if there's anything that you have any concerns about publicly posting, and if you do, please send us a note to the VBP Readiness mailbox. If we don't hear any concerns by the March 22nd submission date, we will just go ahead and post them. The organizational chart. We understand that these initial org charts are going to be extremely different from each other. There are some, as I said, there are some BHCCs that already have a very cohesive structure. They're already ITAs, they already know who their different executive staff are, they know how the team is laid out, and there are BHCCs that are just coming together, and part of the org chart will be planning on how it's going to come together. So either send us the org chart you've already got, or send us your plan for creating one with whatever positions are already done filled in. And same thing with the membership standards. If they already exist, that should be part of the work plan, and if they don't, the plan for how they're going to be created and the vision for them should be included. And again, and you'll be hearing this a lot, updates, changes, and future work plans are expected. What you say on this initial work plan in terms of your vision is not set in stone. If you need to change it in an updated work plan, that's expected. Financial structure. Okay, so I just want to make clear that there's kind of two separate things here. The budget, how the money is going to be spent, is going to be discussed later in detail. That's a whole section of this webinar is at the end. That's one separate thing from the financial structure of the BHCC, financial activities that are going to occur within the BHCC. These are totally separate things. Well, not totally separate, they're separate things, and they're going to be discussed separately. So we want to hear about how financial decisions are being made by the behavioral health providers in the BHCCs. As part of the work plan, you can indicate whether or not there are going to be dues, whether or not those dues are going to be subsidized by BHCC money for members that may need help during the program period, and what your sustainability plan is for those partners, because after this money is gone, if they're going to still need to be paying dues, how is that going to be accomplished? You may also need to let us know if you're going to be getting any funding for the BHCC outside of these funds. Where else would that be coming from? And also the beginnings of a sustainability vision or plan should be part of the preliminary work plan. So all BHCCs need to follow the state summary guidelines for the funding received. There are no further restrictions beyond meeting the program goals, complying with the BHCC's own submitted work plan and budget, and any applicable contract provision between the BHCC and your plan partner. This program is no different from all other state programs in which the state reserves the right to recover funding if it is not spent on allowable expenses. And as to when you can start, what expenses are eligible for this funding, the award notification happened on January 4th, 2018, and that is the start date for allowable expenses. And I'm going to pass it over now to Jonathan to talk about data analytics.
Thanks, Lynn. Good morning. As discussed in previous forums, data analytics and data management is an important part of the BHCC's role. A large part of what you're going to need to do is data collection, management, and reporting on that. The expectation to start is that you'll be developing plans and timelines to support identifying, at the beginning, some baseline data. You should identify by MCO, by managed care organization, the total number of Medicaid managed care enrollees served by the BHCC. That is a starting point. You then would be able to use this data to identify ongoing service utilization trends. These service utilization trends will not just be for behavioral health. The expectation is that they will also address across the behavioral health and physical health spectrums. They should also include how the providers who address the social determinants of health are involved in the lives and the care of the people you serve. Behavioral health providers, BHCCs, are to demonstrate planning and development of frameworks that allow effective participation in risk-sharing arrangements with MCOs and other partners. Ultimately, this all goes back to the, as in slide 1 or 2, the goal of this project. Next slide, thank you. BHCCs are expected to create structures in which they can share data amongst their partners. In order to do so, they will need to review their existing capabilities of their partners and what steps they will need to take to share that data effectively. The work plan should include an assessment of what the BHCC partners, how they currently collect data, what systems they currently use, and their current status. The work plan would consider the challenges to take those next steps in order to share data amongst each other. When reviewing those challenges, you should include in review the considerations of confidentiality and patient consent. That should be part of your work plan. And the BHCCs will need to think about what data they will need to efficiently meet. They will need to officially meet their clinical, quality, and cost goals. Next slide. Now, there's multiple ways in which to share data, and these are some examples, but ultimately the BHCC will need to support internal, external communication. The needs of a shared IT platform should include customization and analytical capabilities. As mentioned, you can do this a few different ways. You can develop partnerships with other entities to meet these requirements. You can work with PPSs, Medicaid Managed Care Organizations, hospitals, PCP offices, RIOs, and you can use the existing PSYCKES data, which we'll talk about in a future slide, that is already available. For example, two New York City BHCCs are looking into working with a New York City PPS on sharing and using their data platform. That is an example of something you can do. Everybody can, there is variability, so there is not one size fits all, but that is an example of a possible path that you can take. Data is only useful if it is used properly. BHCCs will need to take the data they receive and use it to meet their goals. You should develop plans and timelines regarding the use of the data. So this would support the creation of potentially performance dashboards using data to monitor care planning and determine what improvements you can make along the way. Data can support the collaboration with Medicaid Managed Care Organizations, amongst other options. And can't stress this enough, plans will need to ensure that all data activity is HIPAA and 42 CFR Part 2 compliant. That is extremely important part of this. As mentioned briefly before, PSYCKES is an option. For some providers, they have access to PSYCKES data, and I'm sure on HBHCC there's providers who have access to this. PSYCKES data has developed 3 utilization reports specifically for value-based payment. They are about payer mix, provider network, and volume and service setting. We'll go into those a little bit more in the next slide. There was a previous training on this, how these reports are used, and that's the link for it. We would certainly recommend using it and providing us feedback on it as well. If there's certain reports that you'd like to see more data on, if there's positives, negatives, please let us know. We're always looking to try to develop new things, and we would like feedback to know what would work best for your BHCC needs. Also, to kind of remind you, on the OMH website, there is other data accesses available. There is community data available, county profiles, and such. So, going a little bit more into PSYCKES, the 3 reports, there's payer mix. Payer mix is really basically which managed care plans and product lines are my clients enrolled in, that helps you focus on what product lines and what plans you could work with. That helps you know, in my region, most of my clients are with Plan X or Plan Y or on this type of plan. Just as a baseline that helps you understand sort of where you're at in your region, what plans are the big players, and who you could work with to potentially develop next level arrangements. The next report is provider network. Which other providers do I share clients with? So it's basically, you know what clients, what plan they're with. Now you know what providers they're going to see. So for an example, you're a mental health clinic, an Article 31 OMH clinic. Which SUD services do they use? Which ER do they use? Which outpatient medical services do they use? This will help you identify that. This will help you then focus on your partnerships. You can identify who you like to partner with. And the third report is service and setting volume. So which services are the clients using from you, from other providers? How many encounters per year by service type? are clients having at your agency, at other providers in total? You know, what is their volume of services that they're receiving? You can then use this volume data to help model costs. You know, you can understand high utilization, low utilization, and sort of take the next steps in developing your metrics. And with that, I will turn it over to Sarah for quality oversight.
So quality oversight, as you know, relates to the BHCC's steps towards identifying and implementing measures, data collection tools, and developing systems to facilitate monitoring continuous quality improvement of your BHCC. In the application, we asked BHCCs to either describe their current VBP outcome performance practices if they were already a group, or if the BHCC was a newly formed entity, submit their plans on how they'll determine which measures to use and monitor their internal performance, and of course, what their process of reporting collected measures and outcomes to the BHCC partners. In the deliverable template, now the BHCCs are being asked to specify what the results of those determinations were. In preparation, we strongly recommend the BHCCs to review what was submitted in their application. So there's three pieces to submitting your quality oversight plan. First, in the deliverable template, we're asking that to use that as your guide to specify the BHCC's plan and timeline for determining which measures will be utilized to monitor internal performance, as well as your plan and timeline for reporting the collective metrics and outcomes to your BHCC partners. For the financial portion, which will be gotten into more detail later, there are questions that came in about what different types of things would be your costs and fees. For your quality insurance, costs and fees may relate to consultants or other entities specializing in quality assurance practices, costs for meetings, stakeholder work groups for developing quality assurance measures and monitoring practices, training staff, implementing and monitoring quality assurance practices, and then developing and implementing an accessible dashboard or some type of reporting system to inform the BHCC partners of outcomes in a timely manner. Just as we asked you in the application phase, we are asking you to resubmit your BHCC member submission template and then describe the current VBP outcome and performance arrangements of your members. And with that, I'll hand that over to Ileana for the clinical integration portion.
Hello again. So as we stated in the purpose of the funding for the BHCCs, the state is very much interested, together with our plan partners, about the BHCC work towards clinical integration. So the overall objective of the BHCC clinical integration component is to support work among the BHCC network and affiliate providers in a manner that establishes practices, protocols, or service coordination activities that facilitate care coordination and integration of clinical activities across the BHCC, as well as with the physical health providers and community-based agencies addressing social determinants of health. As we've stated throughout today's presentation, the BHCCs have the flexibility to define and establish the scope, content, and focus of the practices, protocols of service coordination activities, but the overall focus would be to facilitate access to services and connect service recipients to the BHCC system of care. Examples of this include, but are not limited to, so again, it's that theme of flexibility. So examples include things like incorporating face-to-face handoffs upon intake and discharge from participating hospital inpatient units, rapid triage of new referrals to avert or moderate need for higher levels of care, clinical consultation across healthcare disciplines, creation of a referral format for connecting clients with services within and beyond the standard practices that increase engagement and retention between BHCC agencies and community services. And finally, BHCCs do have the flexibility to develop clinical indicators that are unique to that BHCC, but BHCCs are strongly encouraged and advised to review and consider organizing around the already established Category 1 and Category 2 VBP metrics information that is available at the Department of Health website off their DSRIP site, their VBP library, and we'll be able to supply that link. So with that, we're going to transition to Patricia to talk a little bit about the budget.
Good morning. This is Patricia Parazelli, and I'm going to walk you through the budget template for the program, which will accompany each work plan submission. Not to be confused with the financial structure of your BHCC, which was mentioned by Lynn earlier in the webinar. This section is meant to help you think about how to spend your readiness funds and how to report those expenses back to the state and your partner MCO. So just as a reminder, the slide walks through the payment schedule for this program. Program year 1 has already begun, and you're all in the process of working with your partner MCO to sign a contract to release the first payment, or you might have already done that. Your second payment will be upon approval of the preliminary work plan and other documents described in this webinar. Years 2 and 3 will parallel the state fiscal year of April to March, and payments will be released twice during those years, contingent on the approval of the work plan updates. Unspent funds may be carried into the next program year. BHCC activities and budgets will vary by BHCC, as you've heard multiple times in this presentation. The budget template is designed to allow the BHCC to itemize the major activities and projects supported by the program as stated on the BHCC work plan. The items outlined on the budget template are examples of allowed activities but are not meant to be an exhaustive list, as the BHCC activities may vary. As described in the BHCC award letter, BHCC funds may not be used for network and affiliate agency salaries for routine functions, but funds can be used to hire or fund staff focusing on specific BHCC functions, and funds cannot be used for previously incurred expenses. So BHCCs may utilize funds to support BHCC-related activities from the date of the award letter, and that is January 4th, 2018. And again, unspent funding from BHC Project Year 1 may be budgeted in Project Years 2 and 3. So this is a sample of the budget template. The budget template will contain a section for each of the 4 work plan readiness areas. As an example, the slide shows the section where a BHCC would report readiness activities related to organization. The state would like the BHCCs to project the spending on each readiness activity over the 3 years of the program. I'm going to give you a few examples of ways that BHCCs can use the funds received under this program to support organization. BHCCs are not required to do any of these activities as long as the funds are spent in service of the goal of preparing to enter into value-based payment arrangements. There are many administrative costs associated with development of a governance structure and strategic organizational planning. These funds can be used to support any or all of those costs. If a BHCC is an IPA or is planning to participate in an IPA that has membership fees or dues, the BHCC could decide to pay the short-term membership costs for a network provider that wouldn't otherwise be able to participate. And of course, contracting with legal or business consultants to assist in the development of the organizational structure of the BHCC is allowable. Talking about data analytics, a lack of data infrastructure and connectivity can be one of the biggest barriers to participating in a payment arrangement based on performance. Ways that a BHCC could use these funds to support data analytics would include purchasing hardware or software required to connect network partners to an existing data management system, or with or without analytic capability, paying startup or ongoing costs for analytic tools on a shared data platform, hiring either internal or contracted data analysts to use your market data and the market data of the BHCC partners, obtaining or developing training programs in data management for analytics or for staff at BHCC partners. The BHCC is going to need to work together to select measures to use to monitor internal performance for continuous quality improvement and to identify appropriate outcomes and performance measures. These funds can be used in support of meeting those quality oversight deliverables. Activities might include the development of a quality oversight committee or other meetings of stakeholders to develop quality assurance measures and monitoring practices, developing trainings and protocols for collecting and reporting on selected measures, developing or implementing a quality reporting system or dashboard, or potentially hiring a consultant to help implement the BHCC's quality strategy. Clinical integration activities may vary considerably between BHCCs depending on the organizational structure. As Ileana said earlier, the overall objective is to support work among the BHCC partners in establishing practices, protocols, and service coordination activities that facilitate care coordination both between behavioral health providers and with the greater care system and the local community. Some allowable expenses towards meeting that aim are costs of convening stakeholders to develop the care coordination practices, costs related to training partners in best practices and protocols and service coordination activities as agreed upon by the BHCC, costs for developing or implementing clinical counseling across healthcare disciplines, or consulting, and developing tools to track the success of clinical integration activities with the goal of continuous quality improvement. Lastly, we want to draw your attention to some resources at your disposal while you develop your work plans. John talked a little bit earlier about the resources available to you through PSYCKES and on the OMH website. Also, we'd like to encourage BHCCs to work with their local OMH and OASIS field offices and with your PPS partners, as they can be invaluable resources about your local region. As always, you can reach the state staff working on this project at the VBP Readiness mailbox, and all of the published documents are on our website listed on this slide. Please reach out to us if you have any questions on this presentation or on the program. Thank you all for joining us today on this webinar. We look forward to hearing from you and seeing your submitted work plans in the future.
Thanks, everyone.